news from the maker of a popular weight loss drug. A week ago today, Eli Lilly announced it was slashing the price on one of its weight loss drugs in half, but it's still almost $500. This comes as recent changes went into effect for even cheaper copycat versions of weight loss medications. And of course, as pictures and promotions fill our timelines about slimming down for summer. We have a warning tonight about dangerous counterfeits flooding the market, so buyer beware.
Chief Consumer Investigators Annetta Lowe shows us how to spot a real from a fake and uncovers new details about a black market bust that sent patients to the hospital.
A shot at better health.
They come in a simple pen
with a promise to help shed the pounds.
With the injectable medications, we expect to see about 15 to 20% of their total body weight loss.
What has that meant for some of your patients?
It's been a total game changer, quite frankly.
Dr. Virginia Weaver is talking about drugs like Ozempic, Wegovy, Mounjaro, and Zepbound. The first was designed for diabetics, and now some are FDA approved solely for weight loss. Board certified in both surgery and obesity medicine, Weaver spent a career spanning 2 decades helping people who struggled with their weight. The results from the newest drug, she says, are different.
A life-altering change for a lot of our patients.
But paying for that change can be costly. The list price for the medications commonly referred to as GLP-1s can be more than $1,000. New savings programs have slashed that in half, but still not cheap if you're paying out of pocket.
It's hard to tell a patient, hey, you might have to pay $500 a month if your employer doesn't cover this medication every month for the rest of your life.
So lots of people have turned to cheaper copycats or compounded versions of the drugs.
Pharmacies started compounding these medications when there was a shortage of the drug.
But the FDA recently declared the shortage over, essentially banning compounded semaglutide and tirzepatide, the active ingredients in the brand names.
Still with a high price for the brand name medications. And if compounding pharmacies do slow down or get shut down, people are out there searching for other options, and that's where things get dangerous.
But there's no sign of a slowdown. From weight loss clinics to wellness spas and online, knockoff GLP-1s are everywhere and being promoted as the answer to the summer slim down.
When the WREG investigators asked the FDA how it planned to enforce the new rule, a spokesperson said they're using a risk-based approach and it will take action when violations occur. The agency recently posted this document calling out concerns over unapproved GLP-1 drugs like dosing errors, saying usage is risky for patients. The FDA says it's received 1,000 reports of adverse events related to compounded versions of semaglutide and tirzepatide. In addition to potential dangerous copycats, the agency has also warned about straight-up counterfeits.
What's your concern with something like that?
If there is contaminants, allergens in it, that sort of thing, and that gets injected, I could foresee patients dying from these sorts of black market, if you will, medications.
So we started getting complaints from people in the neighborhood, hey, this lady's selling this stuff off her front porch.
And take a look. This is what agents from the West Tennessee Drug Task Force found beyond that front porch, inside a Medina home just north of Jackson. Hundreds of vials and shots labeled semaglutide, tirzepatide, retatrutide, and congrilantide in what Johnny Carter said was a black market bust.
The vials themselves were marked not for human consumption, for research purposes only.
The woman allegedly behind the black market operation, Emily Arnold, faces several charges, including selling a legend drug, impersonating a licensed professional, reckless endangerment, and money laundering. Carter says Arnold sold the supposed weight loss drugs from her website and to 2 clinics, Medina Weight Loss and Wellness and Haywood Weight Loss. The latter has since closed.
Why would 2 clinics where medical professionals are working go through this woman to get their GLP-1s?
It's a good question, and I'm not going to elaborate too much more on that because that's still an ongoing investigation.
So there could be more arrest?
It's possible.
Between the clinics and Arnold's home, agents seized nearly 700 vials and 150 grand. Snapshots show handwritten pricing on a sticky note. The drugs kept inside a mini fridge with soda, and not far from that small refrigerator, dog feces on the floor.
We walk into this home and there's dog feces as soon as you're walking in the house. So, right there on the floor.
Carter says they set up a complaint line and got more than 60 responses, ranging from the meds not working to hearing from folks who ended up at the ER with abdominal pain and injection site infections.
It's buyer beware. You don't know what you're putting in your body.
The task force sent the products to Eli Lilly, the maker of the brand name tirzepatide, Zepbound, and Mounjaro.
Currently, preliminary testing, not full testing, says it's not tirzepatide in a bottle that's purported to be what tirzepatide is. It's just what they consider to be water,
So there was nothing
like
in
a
it?
sterile water.
Carter says trying to save money with what you think is a cheaper weight loss medication can be costly to your health and is no different from buying illegal street drugs.
What's your biggest piece of advice to someone watching this?
Don't buy off of anybody's front porch. Go and get it through legal channels.
I would 1,000% steer everybody, like under no circumstance should you be going online and getting it from anybody that is not reputable.
So what should you be asking no matter where you get your weight loss meds from? Dr. Weaver says start with your doctor. Avoid places that don't require an assessment or address your medical history, and ask where they get the product from.
Not only is it fair to ask the doctor, it is your duty and responsibility to your own health to ask where that drug is coming from, if it's being mixed with anything.
And get a closer look. The FDA posted these photos of real versus fake Ozempic side by side. The color and wording on the counterfeit is slightly different. Investigating for your news leader, Zanetta Lowe, WREG News Channel 3.
Emily Arnold is due back in court July 9th. In a Facebook post after the bust, the clinic said it had no prior knowledge of her actions. We reached out for additional comment and we're waiting to hear back.